elbow joint. Now, any joint you are going to study, you have to know the bony framework. What are the bones involved? Is a particular joint. It can be a wrist joint, it can be hip joint, it can be shoulder joint, it can be an articulated foot, and it can be your in the head and neck, the mandibular joint. So they have a common architecture and plan that it has to be, the bones has to have surfaces that will glide in between the corresponding bone. Like say in the elbow joint, it is in the upper limb. Now, what are the bones involved? Your humerus and radius and ulna. Okay, and it is a synovial joint or fibrous joint, or it is syndesmosis. Now, the joints in general anatomy, you please read that first. General anatomy, what is the different types of joint? You read the general anatomy today, it's only few pages and there are few illustrations and diagrams, and you just draw and label it. From the book, when you copy paste, just say in this, I'm telling you, like Rabindranath Tagore, he's composed many songs, he's written many songs, and he gave the tune Sood, Rabindranath Tagore had given. Now, few are from Scottish, English, these melodies or this thing were copied, but that was put in Bengali. So any artist even, nowadays the common thing, copy paste. So first, whoever as an artist or anything will have to copy and paste. Now, just don't panic, I tell you, don't develop panic in these first few months. Otherwise, it will be carried on your head throughout the year. Don't panic. You have to answer. That is, you hold the humerus. Don't think, the examiner will tell you only what is the humerus, upper end, lower end, the descriptive part. When you say the lower end, then he might go and ask you what joint is formed. You go to the upper end, what joint is formed. Now, what are the two corresponding bones? That is the articulated or bones, bone or bones. It can be multiple bones. Now, with this idea, and it should have a gliding this thing. And you see your Virat Kohli, he shot 2 centuries. Now, that is all the joints that is involved in the upper limb, and also the foot and everything. All the things. They used to go to this like a dance. When you dance any dance in any form, it might be a jazz, it can be a ball dance, it can be Bharatanatyam, it might be Odissi. It is the whoever like with perfection dances. You can see, you get amazed seeing the TV or your Facebook, how these people, ballet, then gymnastics, you keep in head that These are the joints that are involved. So with this brief introduction, now the type of joint, it is synovial joint. Okay. Now it is a compound joint, hinge variety, uniaxial joint. When you read the general anatomy of joints, you will get all this descriptive. So, so once I repeat, is that it's a synovial joint, it's a compound joint, hinge variety, uniaxial. And the bones involved in the lower end of the humerus, this is the capitulum and this is the your trochlea. Now, the trochlear notch of the ulna, the trochlear surface, articulates with the trochlear surface of the humerus. This is the capitulum, this is the head of the radius. Now, the radius over here is articulating. Now, once you do this, you go to the gym, you will be lifting up weights, you pick up, even these are all involved, these joints are involved. Now, I would say, now articulating surfaces. So, it's a basic concept if you develop, then you know the articulating. One bone articulates with the other, that is the upper articular surface, capitulum and trochlea of the humerus, lower articular surface, upper surface of the head of the radius, and trochlear notch of the ulna. Okay? Now, fibrous capsule. So, the joint can be just two bones. When you dissect or prosected bodies, you will see the total, the fibrous capsule, the envelope the joint completely. It envelopes the joint completely, thin in front and behind, thickened at the sides. Now, see, the elbow, you put it in your anterior abdominal wall like this. Then you do this. Okay? Now, a beggar comes. You give vikka dao, vikka now. Vikka dao, vikka now. So it is over here it is the actions plus in the like this. So, am I clear? Now thin in the front and behind and thickened at the sides. See, this is the radial collateral ligament. This is the annular ligament of the head of the radius. Saxiform recess of synovial membrane, ulnar collateral ligament. See the expansion of the fibrous tissue, the radial collateral ligament, the anterior thin in front and behind and thickened at the side. See, it is more thickened in the sides and anteriorly this thing. Now, because see, when you dissect or see the cubital fossa, you see the artery and the vein. So, it is designed this. So, you want to take a few cc of blood for some investigation. First, we try it in the cubital fossa. Okay, another place is here, the artery here. So, these are the points and this is now fibrous capsule attached along a continuous line at the lower end of the humerus, includes all the three non-articular fossas, excludes the epicondyles, distally attached to the margins of the trochlear notch, blends with the annular ligament. Now the fibrous capsule, I showed the previous slide which I had shown you. Again, if you fibrous capsule attached along the continuous line at the lower end of the humerus includes all the three non-articular fossa, exclude the epicondyles, and distally attached to the margins of the trochlear notch, blends with the annular ligament. Now you see the fibrous capsule, the radial fossa is here, the capitulum, the trochlea, and the capsular ligament, this green in capsular ligament. And this is the choroid fossa and medial epicondyle and trochlea. Now capsular ligament here, the auricular fossa, medial epicondyle and trochlea. Now the auricular process, the capsular ligament, see the covering here, and this is the head of the radius, this is the trochlear notch, and you see the green, this is the radius, this is the annular ligament. Now in green is the fibrous capsule. What is, you go in your practical class or today, if you have the bone set news, please see it in the your evening. You see the bones you hold in groups, 4 of you or 2 of you, and study. Just then it will be again, it will be in your head. Okay. And no book is different from the other. So stick to one book. If you see Bisram Singh, to bhalo, and to download korte bose gele. Don't. All Singhs are same. Datta, Mitra are same. Okay? Now, ulnar collateral ligament, it's a triangular in shape here, ulnar collateral ligament. The posterior band, the auricular process, the anterior band, and the coronoid process here, inferiorly oblique band. Okay? The apex attached to the medial epicondyle of the humerus here. The base attached to the coronoid and auricular process of the ulna. Base attached to the coronoid and auricular process of the ulna. What you do, you take the bones and you just mark with your chalk the capsular ligament where it is. Or you draw, seeing the bone and study. Now, ulnar collateral ligament, the anterior part in front of the medial epicondyle of the humerus, tubercle at the medial margin of the coronoid process, posterior part back of the medial epicondyle of the humerus, medial margin of the auricular process. Inferior part, oblique band, and extends between the auricular and the coronoid process. This is the anterior band. This is the coronoid process. This is the posterior band. Now, this is radial collateral ligament, triangular in shape, extends from the lateral epicondyle of the humerus. Below it blends with the annular ligament. Here is the annular ligament. And you see radial collateral ligament. Now, stability of the elbow joint. The ulnar collateral ligament, radial collateral ligament trochlea of the humerus fitting into the corresponding notch of the ulna. So, at the beginning I told you that the body surfaces, they articulate and it is covered by the capsule to give the protection, plus the synovial fluid is there. Actually, trochlea of the humerus fitting into the corresponding notch of the ulna. The basic design is this, that the humerus, the trochlear surface of humerus fitting into the corresponding notch of the ulna. One thing, you have one booth, you know, the skeleton, whole skeleton in the dissection hall. If you have time, when you go for dissections or whatever your demonstration for osteology, you please correlate and study there. And rest is that you be the model. You be the model. This is a beautiful picture. You will get it in every book. This is the relation of the elbow joint. Now, it's a simple drawing. Now, you see, this is the basic design. Now, this is the musculocutaneous nerve, tendon of the biceps, brachial artery, medial nerve. So, when you are withdrawing blood, you please feel the pulse and then you withdraw. If you see the brachial artery is related to the medial nerve, don't prick the nerve. Then the patient might be injuring the nerve itself, and then he or she will complain of pain. So you just have to feel the pulse like this. Like this. You get it. And then you prick. Okay. And one thing is that, see, when it's winter, you're netting, you put a tourniquet here. Tourniquet. Then you just ask the patient to do this. Or you do this, do this. So the muscles pump and the your and tendon of the biceps, this is the biceps. Whose biceps is big? Hrithik Roshan, Salman Khan, your Shah Rukh Khan, whose muscle is big? Hrithik Roshan or Shah Rukh Khan? Anyway, you will think for yourself. Another thing is that this is nerve to anconeus. This is the anconeus muscle. The tendon of triceps. This is the tendon of triceps. The tendon of triceps, and the cutting edge of the joint capsule. This is cut. Ulnar nerve is here. The common flexor origin and flexor carpi ulnaris. This is the common extensor origin. Extensor carpi radialis and radial nerves. Now you see the two epicondyles were outside the capsule because all the extensors and flexors of the wrist joint is your elbow joint. Though the tendon is there, common tendon, and then is expansion, and all the forearm muscles are there. Now you see bursa in relation to elbow joint. Now the bursa in relation to elbow joint. Subtendinous bursa between the triceps and upper surface of the olecranon process. Subtendo-olecranon bursa. Subtendo-olecranon bursa. Now you see, this is the biceps, This is the tendon of the radius, annular tendon of the radius. Now this is the intermediate band, interosseous band, and this is the your humerus. This is the ulnar nerve. This is the radius. This is the your this is the anterior band. The ulnar collateral posterior band, intermediate band, anterior band. Ulnar collateral ligament. Now, inflammation of auricular bursa, bursitis, and normal auricular bursa. See, sometimes a patient comes with a complaint over here. If bursa repeated use or misuse, it becomes repeated inflammation is there, and there is swelling. So don't immediately go for a cut until unless it is having any greater problem. Cosmetic thing is, you have to see between cosmetic and functional. You cut it, then what is the function goes? The function of the bursa, basic concept. But if it's a great swelling, then you have to plan accordingly and then go for the operation. But you don't give a local anesthesia, you make an incision, you see your synovial fluid, thick synovial fluid coming out. Now, subcutaneous bursa between skin and posterior surface of the auricular process. Yeah. See, this is small. You palpate your things, you won't get it. It's like a small pouch. Okay? But when it is inflamed, it will be painful. And now movements of the elbow joint. Now, flexion, brachialis, chief flexor, biceps brachii act when forearm is supinated. Forearm is supinated. Okay. Now, brachioradialis acts in the mid-prone position. In the mid-prone position. This is prone. This is mid-prone. Now, if there is brachioradialis, when you study ulna and radius and the muscles, the extensors and flexors of the forearm. Now, extension, triceps, chief extensor, and coneus assist in extension. Now, the biceps is this. Now, I go like this, and your triceps, chief extensor, and coneus assist in extension. Now, you see, this is important as a short note. Carrying angle. What is carrying angle? Okay. Now, elbow extended and forearm supinated. The elbow is extended and forearm supinated. Obtuse angle between arm and forearm on the lateral side, carrying angle. This obtuse angle. In the lateral side. Now, useful to carry objects grasped by the hand. Useful to carry objects grasped by the hand. Okay. Now, medial edge of trochlea. Medial edge of trochlea projecting below the lateral edge. Angle obliterated with flexion of the elbow or pronation of the forearm. This angle is, carrying angle is obliterated. Now, one thing is that any fracture in the elbow, it can be supracondylar fracture, which is very common. Now, that the portion of the carrying angle is lost. That's why you see, if anyone is walking into a chamber, he will be walking like this. Some people, but this end is okay. Or this he carries on like this, এরকম. Then the carrying angle is lost due to fracture, supracondylar fracture. And now clinical anatomy, see supracondylar fracture of humerus and tennis elbow, lateral epicondylitis, tennis elbow, lateral epicondylitis, pain and tenderness over lateral epicondyle, injury to the lateral collateral ligament, injury to common extensor origin. Now, these two, you get a short note for 4 marks or 2 marks or something like that. Okay, now you see why it is called tennis elbow. Those players who playing tennis, so or they are playing the tennis. Naturally, it goes like that, gives a shot, or it just jumps like this. So that hyperextension of the joint, and that repeatedly. So that's why, or a patient comes to you without such activity, like playing tennis or golf, but she complains of the pain. That's why palliative treatment, you give your band is there, the tennis elbow band, the companies have come out with black band. Sometimes you see in the people moving around with black band over here. Then think of it is a case of your tennis elbow. And see, this is the injury to lateral core ligament, injury to the common extensor origin. Now, golfer's elbow, medial epicondylitis, golfers, pain and tenderness over medial epicondyle, injury to common flexor origin. This is the extensor origin, and this is the flexor origin. Yeah, here the flexor, this is. Okay? Now, golfer's elbow. Similarly, who plays golf, you stick like that and put the ball goes into a hole. Okay. Now, this is the thing that a tennis elbow and golfer's elbow. One is in the injury to common extensor origin, that is your tennis elbow, and golfer's elbow is the injury to the common flexor origin. One is extensor, one is flexor origin. Even you are saying you are doing very well with the Viva table, and you are scoring around 80%. Now examiner wants to question you. Now tell me the difference between tennis elbow and golfer's elbow. Okay, now why I'm telling you that, like your mother preparing some pulao or something like that. One handa is there, all the rice is put in. Now she picks up, after boiling the rice, she picks up a spoon and then she presses. It's boiling, thik hoye che kina. Similarly, the examiner, whoever is the examiner, the external or the internal, he knows that a student of Podachikira, this student is, now I should give him some extra marks, not extra marks, it is your due, it is your, you ought to get. Now that is, like he can, your mom presses the rice and sees then no more boiling. Then it becomes kheer. Okay. Kheer, if it is overboiled, it doesn't matter because it is more, it will be nice. And now what I'm telling you is this. Now see, radioulnar joint, superior radioulnar joint, synovial joint. Middle radioulnar joint, fibrous joint, syndesmosis. Middle radioulnar joint is syndesmosis. inferior radioulnar joint, synovial joint. So superior radioulnar joint and inferior radioulnar joint, they are synovial. And middle radioulnar joint, this portion, this. Yeah. The middle ulnar joint is the fibrous joint, syndesmosis. Now you see superior radioulnar joint, synovial joint, with what variety? Uniaxial. This joint is uniaxial. Now these are these three bones are the component of the elbow joint. Now you see the head of the radius, this is the radial notch, annular ligament, this is the ulna, and this is the radius. Synovial joint, pivot variety, uniaxial joint. Now, articulating surfaces. I told you at the start of the lecture that two bones or three bones or multiple bones, they articulate with each other to form a specific joint. Okay, now your circumference of the radial head of the radius. Now, this is the radial notch, fibro-osseous ring, radial notch of ulna and annular ligament, fibro-osseous ring. This radial notch of ulna and annular ligament. Now, ligaments. Fibrous capsule continues with the capsule of the elbow joint attached to annular ligament. This is the annular ligament. Annular ligament encircles the head of the radius, holds radius against radial notch of the ulna. The radial notch of the ulna, you pick up a bone today, these three bones, and just read. Compare your atlas or your book, your things will be clear. First read the general anatomy of the joints. Then you go home today, pick up the three bones, and within you discuss and see and point out. Today, do it today. Okay. Now, the quadrate ligament from the neck of the radius, upper part of the supinator fossa. Now, inferior radioulnar joint, it's a synovial joint, pivot variety, uniaxial. See, this is the fibrous osseous here. The radius and the ulna. This is the ulna. This is the radius. Radius as a lower end is broad, but old ladies in the outstretched hand, she falls. Actually, what happens? She's getting disbalanced. What she did, she stretches her hand and okane, but there's a fracture in the radial end. That is known COLLES, Colles fracture. I'm just giving you, this is the short form of fracture. In your prescription you write, okay? Now, articulating surface, the convex head of the ulna, concave ulnar notch of the radius. Ligaments, fibrous capsule surrounds the joint attached at margins of the articular surfaces. Articular disc, apex attached to the styloid process of the ulna. This is the styloid process. Okay. Now, process of the ulna, base attached to the ulnar notch of the humerus. This is the capsule. This is the ulnar notch. The ulna articulates here, the head of the, and articular disc, proximal surface, and palmar capsule ligament. Now the rest is the palm of the hand. Okay. There are some numerous bones which will be taught to you. Movements of the radioulnar joint. Now, supination, supinator, bicep brachii. Now, supination. Now, this is the radioulnar joints, supination. And the supinators are bicep brachii. Pronation, pronator teres, pronator quadratus. Pronator teres, pronator quadratus. You conceptualize, you see the bones, you see the muscles involved in the specific. Now, the two epicondyles are left for the extensors and your supine. Flexors and the extensors. Okay, this is for today, but you go home. How many of you have personal bone set? Most of you. Actually, you are in the house or your hostel or Raj Nivas, PG. So, whatever it is, you have to study. ठीक है जी?